As a human-in-the-loop BPM 4.0 company, we at Annova leverage the core pillars of BPM 4.0: data and tech, risk adjustment and expertise, security and compliance, talent innovation, to deliver continuous ROI to clients. Our services span the entire risk adjustment spectrum, medical records retrieval. With our AI-empowered contact center agents, we have retrieved 2 million plus records, made 5 million plus outreach calls across 500K plus hospitals and healthcare facilities. HCC coding, quality of care measures, and value-added services. Our team of subject matter experts is comprised of certified coders with healthcare backgrounds, including doctors, nurses, and pharmacists. A proactive force identifying high-risk coding practices, investigating root causes. We provide solutions empowered by AI analytics, such as AI-enabled data aggregation. Before coding, we do an analysis using large language models and Gen AI. The input for the analysis is a lot of unstructured data like demographics, claims data, CPT and PCS procedure codes, lab data from various diagnostic reports, and medication data from pharmacy claims. All this, once ingested by the LLM analytics engines, creates an amazingly accurate output from which we can create the groundwork for HCC coding like suspect analysis, chase list generation for targeted retrievals, AI analysis of coding output. Combining the synergistic benefits of NLP and Gen AI help achieve high coding accuracy and various value-add services. This time, the input for AI is the coding output from our coding teams, NLP keywords from each chart, and the claims data. Once the data is analyzed by the LLM, the output can further enhance the quality and value of coding reviews by providing claims gap analysis, which drives the in-house audits for improving coding accuracy, and roadmap for predictive models, quality of care measures, and extracting social determinants of health. V28, Annova's approach. We are cognizant of the impact of V28 and greater need of accurate documentation and coding practices. See the coding example below to understand how risk scores can get severely impacted under V28 risk adjustment model if conditions are not coded to the highest specificity. The history of present illness has documented higher specificity of major depression than the assessment. Here, the coder is given preference to assessment and coded unspecified major depression, which does not risk adjust as per V28. Our in-house QC system ensures highest code specificity for each encounter by prioritizing auditing charts with unspecified codes is the perfect solution to the changing landscape of HCC coding, where codes are losing risk value. Also see how poor documentation can lead to coding unspecified or less severe diseases, which are non-HCC in V28 and hence cannot add to the patient's risk score. Here the member has a documented past medical history of atrial fibrillation and assessment states supraventricular tachycardia is managed on long-term medication. Again, the coder has decided to go with the non-risk adjusting SVT as the documentation restricts him to code atrial fibrillation, which might be present and is more specific. The solution here is to exploit our years of experience and expertise to provide CDI solutions. Numbers which tell Annova's story. 100% client retention, coded 1 million plus charts in 2023 with over 95% coding accuracy. Leadership boasting 200 plus years of healthcare experience. We can scale on demand to meet any client's needs. Talent pool of nurses, pharmacists, and medical science graduates. 1,000 plus hours of tech-enabled, SME-driven training. Proprietary QC system maximizes code specificity, SOC 2, Type 2, and ISO 27001. Hear from our customers.
Team Annova's commitment to our business is unparalleled. It's hard to deliver the quality we do without their support.
Annova delivers 3 critical advantages: a higher degree of accuracy, an increased focus on compliance, and that ability to scale when the occasion demands. It's always been a pleasure working with them.
Trust Annova to deliver better. Continuous ROI every day.